former President Joe Biden has been diagnosed with an aggressive form of prostate cancer. The diagnosis released today by Biden's office. We told you last week that a small nodule was found in his prostate during a recent physical. In a statement released today, it confirmed that that nodule was in fact cancer and that it has spread to his bones. Reactions are pouring in following the announcement of former President Biden's cancer diagnosis. President Donald Trump posting on Truth Social today that he's saddened to hear the news and that he and First Lady Melania Trump are sending their best wishes to Biden's family, and they wish for a fast and successful recovery. And former Vice President Kamala Harris called Biden a fighter, saying, "I know he will face this challenge with the same strength, resilience, and optimism that have always defined his life and leadership." Former President Barack Obama referencing Biden's cancer moonshot in a post on social media, saying that no one has done more to find breakthrough treatments for cancer in all of its forms than Joe. The former president also saying he's praying for a fast recovery. So let's talk more now about his prostate cancer diagnosis. I'm joined by Dr. Scot Ackerman, Medical Director of Ackerman Cancer Center. Thank you so much for coming in tonight.
Thank you.
So we know that the former president's spokesperson said that his prostate cancer has a Gleason score of 9 and it's metastasized to his bones. In layman's terms, what does that mean?
So the Gleason score is a score the pathologist makes of the prostate cancer. When we look at prostate cancer and we do a biopsy, some cancers are slow growing and some of them are fast growing. And the scale we use is the Gleason scale, and it begins at 2 being the slowest growing and 10 being the fastest. So his is 9. That's pretty high up there on that scale. We also heard it was grade group 5,
right.
And that's just another way of looking at it. We reclassified some of those Gleason scores, but grade group 5 is from a 1 to 5. So this is the most aggressive form of prostate cancer, at least the way it looks under the microscope and how aggressive it appears.
So President Biden's 82 years old. With someone who gets this type of diagnosis, what's the survival rate?
Well, treatment happens to be very good these days for prostate cancer, even if it has metastasized. And with President Biden's case, we know it's in his bone. And the treatment typically is anti-testosterone treatment, hormone treatment to block testosterone. Testosterone feeds prostate cancer cells, and when they have testosterone, they grow faster and they spread to other parts of the body. So most likely, he'll be getting hormone treatment, testosterone, and that'll slow it down. And the prognosis is good. I mean, patients who have not received testosterone before and are diagnosed with prostate cancer generally have a very good response and can live for 5, 10, 15 years beyond that before the cancer starts to grow again and gets out of hand.
And we know that prostate cancer is actually the second leading cause of cancer in men here in the U.S. And so when he was diagnosed, when former President Biden was diagnosed, his spokesperson said he had been experiencing some urinary symptoms. What do men need to be looking out for when it comes to the red flags, when it comes to the symptoms, potential symptoms of prostate cancer?
Well, the problem is the symptoms of prostate cancer are very similar to the symptoms of just prostatism, where prostates grow. So as we get older, as men get older, the prostates grow, and we have a slower urinary stream, where we urinate more frequently, and these are very similar symptoms that prostate cancer has. So there aren't really good symptoms. We like to screen for prostate cancer by doing a digital rectal examination and a blood test, a simple blood test called a PSA. And that's how we find prostate cancers early, and when they're caught early, we have a very high chance of curing them. But if you have that done, and it's normal, you may have some symptoms. Symptoms could be blood in the urine, frequency of urination, painful urination, those sort of things.
So when do men need to start getting screened for prostate cancer?
So I recommend to my patients that all men beginning at age 50 get screened annually for prostate cancer. That's the digital rectal examination, where the doctor examines the prostate, and a simple blood test, the PSA test. But if you're in a high-risk group, meaning that if your father or uncle had prostate cancer, then you should start at age 45. Or if you're African American, African Americans have double the incidence of prostate cancer as Caucasians. They all should start, African Americans and other high risk should start at 45. And if you're extremely high risk, meaning if you're African American and you have a father or a brother who's had prostate cancer or an uncle, you should start at age 40.
Does it surprise you that his cancer is so far advanced as far as the aggressiveness of his cancer?
Yes, it does. The president gets an annual physical examination. You would think that his PSA would be checked every year. You would think that his prostate would be examined every year. But the aggressive cancers can creep up on you, and they could, because it's aggressive, it might have started after his last screening and is growing now. Or or he's 82 years old, and so maybe last year his PSA might have been mildly elevated. And the truth is, when men get older, the PSA is elevated anyway, and that's hard for us to distinguish whether that's just a normal elevation of the PSA or whether there's cancer there. So he might have had a mildly elevated PSA, and it was attributed to the fact that he's just getting older.
Right. Okay, well, very important information, and I guess the good news that can come out of this is more awareness about prostate cancer, and hopefully more men will go and get screened. Dr. Ackerman.
And cured.
And cured.
Right.
That's very important. Thank you so much for coming
you.
in tonight. We appreciate your insight.
Thank you.